Hello class, we're going to talk about facilitation of diaphragmatic breathing, which is used to improve ventilation to our lower lung segments and also to increase perfusion in individuals who are using a lot of upper chest breathing. It will also help us decrease upper chest breathing and the use of accessory muscles such as your sternocleidomastoid, your scalenes, and helps to ease the work of breathing. So Eder is going to instruct me in how to do this process, some positioning that we're going to use for diaphragmatic breathing, and also some facilitation techniques.
And we are pulling this information from your pulmonary treatment table that we uploaded to Canvas, so feel free to follow there. Okay, so the first thing we're going to do is just try to kind of allow the patient to, we'll have the patient relax a little bit, so go ahead and relax, and we're going to just observe how they're breathing. In order to start facilitating the diaphragm in this seating position, what we can have them do, believe it or not, is actually sort of slouch. So we're looking for this posterior pelvic tilt where they're slouching, which is actually going to facilitate the diaphragm. So if we're seeing somebody who's doing a lot of upper chest breathing, remember a lot of movement up here, exactly. Not only can we provide them with some manual cues and tactile cues, but we can also have them slouch a little bit. So I want you just to kind of relax, slouch. That inhibits upper chest breathing in most people, and it'll actually start activating the diaphragm a little bit. If for some reason we wanted to do the opposite, I should say, then we would have them sit up tall, right? There you go, bring your hips forward, and we would start getting a little bit more of that upper chest breathing. Now remember that we're going to see a lot of upper chest breathing with individuals who are fighting for breath, individuals who of course have diaphragmatic impairments of any sort. Let's see what else.
In some cases, we might use this position because we want to facilitate accessory muscle use, and especially in those people who have a weakened diaphragm, such as individuals that may have a spinal cord injury. We want to encourage upright posture in order that they can use the accessory muscles to assist the breathing efforts, especially in those individuals that might have a higher cervical level spinal cord injury.
And so we talked a little bit about last lab about making sure we really observe these breathing patterns, right? Everything kind of starts from the belly up, and we'll talk about that here in just a little bit. So diaphragmatic breathing is extremely important for patients who have these pulmonary conditions, especially if they have some restrictions because their upper chest is restricted in some way. So we want to make sure that we encourage diaphragmatic breathing in any way, in any manner possible. And also, it can be very, very relaxing to patients, and it can be something where they finally start feeling like they're catching their breath and they start reducing that anxiety and that hunger for breath. So there are certain positions that are better to perform diaphragmatic breathing than others, so we have to make sure that we are kind of conscious of the patient that you have. If you have somebody who, for example, is pregnant, right, we probably don't want to lie them supine too much, so we want to position them in a position where we're not going to be placing a lot of stress on the diaphragm. We can place them like this with this kind of long sitting, or we can put them, try to move some chairs, with a wedge behind them, or if you're in a hospital bed, you can always sit them in about 45 degrees. And that way we can really start having them relax. So at this point, you can even better, if you go ahead and relax, you can leave hands on your side so we can observe what's going on. You have a better observation of how the patient is breathing. We're going to be just instructing them to just relax. Go ahead and just close your eyes, just breathe normally, pretend I'm not here. If this is a comfortable position for your patient, at this point we're really looking at how the breaths are starting. We talked about facilitating diaphragmatic breathing last time. So we can start by just telling the patient to just relax. And we also talked about being courteous, of course, of males working with females and such. So what I'm going to actually do is I'm going to have her place her own hand on her chest, belly, and then I want you to place your other hand on your chest too for a second for me.
It's 8:28. Good morning, pal.
That was Mickey Mouse. And at this point, we can have her just to kind of feel the breath. So I want you to just feel the breath. Breathe into your hand if you want to imagine that. Every time you breathe in, I want you to imagine like you're breathing into your hand. Breathe in your nose. Good. And breathe out your mouth. There we go. If we're still seeing a lot of upper chest breathing, Once we have them breathing down here, we want to have them visualize what is happening. We can have them, I'll have you switch just one hand up here, and feel the movement on their hand. For example, we talked about last class, we want this hand, if it's their dominant hand, on their belly to move first when they breathe in. We'll talk about some inhibition techniques here in just a little bit. Let's see, what else? Anything on this you want to add?
If we want to provide a little resistance, we can have the patient place their hand just about their xiphoid process, one hand on the top of the chest, and then Edo can provide me some manual resistance on my lower hand to facilitate some resistance to the diaphragm. So I'll let you help me out with that.
And something that I really like about these techniques and using the patient's hands, that we can use the patient's hands as well, is that they really have that tactile kind of input of what's happening. By placing your hand above theirs and placing pressure on their hand, you can really instruct them on, you can demonstrate how much pressure you are utilizing. So when they're doing this on their own, they know how much pressure to use. So as she takes a deep breath, I'm just gonna kind of relax her, and I'm gonna put a little pressure in your hand. There you go. And good. So I'm placing just a little bit of pressure. Do you feel that? When she takes a breath in, right? We're not really working on placing pressure when she exhales right this second.
And then Edo can also facilitate my diaphragm by using some PNF techniques by scooping into the diaphragm and putting a quick stretch as I breathe in. So I'm going to move this hand so he can place his hand directly on my chest.
Good. So remember, we're looking for kind of that subcostal angle, right? We're going to, right at that, there you go. We're going to scoop a little bit. Good. And this position can also be done in sideline. So all I'm doing is just kind of putting a little pressure as she breathes in and kind of pushing up. Good.
And he can also do a quick stretch at the end of exhalation. The other thing that people can be encouraged to do is to sniff, like they have a runny nose. So Edo's going to instruct me in that technique.
Yes, and we talked about how sniffing is one of the best techniques to initiate diaphragmatic movement, right? If none of this is working, or if you want to start with the sniffing technique so we can start instructing them how to move the diaphragm, it's also great before we start doing any manual resistance. So I want you just to relax, good, and just breathe normally as you would. Pretend I'm not here, good. Now what I want you to do here, and don't do it quite yet, is we're going to work on kind of making sure your diaphragm is working properly. So we're going to work on some sniffing. Again, don't do it quite yet, but it is literally what it sounds like, as if you are sniffing something at home. But I don't want you to take large sniffs, large breaths. Essentially, it works like this. You're going to breathe normally, you're going to let the air out, and before your next breath, a quick little sniff, good, and then let the air out, good. After that sniff, you can take a breath in if you need to, and let the air out. But that's really going to initiate kind of a drop of the diaphragm if it's not moving properly, and it'll kind of start pursuing this breathing re-education, right? We want to retrain kind of how the patient's breathing. I made the analogy in class, when somebody has a stroke or something like that, we literally have to teach them how to walk again. Sometimes we have to teach our patients how to breathe again if they've been doing it chronically incorrect or they have restrictions.
The other thing we can do is some timing for emphasis, which is a PNF technique, to kind of have the patient perceive where they're breathing. And once they kind of get the hang of diaphragmatic breathing, to help them direct their airflow into where your hand is placed on their chest. So what we're going to be doing with this is we're going to first feel where they are breathing, and then we're going to give the patient some tactile feedback. So let's say I wasn't expanding this side well. So timing for emphasis would be, I would be placing my hand over on this side. The patient can do it themselves, or the therapist can provide that tactile cue. And as they breathe in, I would say, now try to breathe into this hand. So I'm gonna let Eder go ahead and do that technique so you can see what that looks like.
Just to not cross over in the camera, I'm gonna do it on this side, but it's the same concept, right? So essentially, I'm gonna place my hand here, and every single time that we perform a technique, it is my preference to just allow the patient to relax. I want you to relax and just breathe normally as if I'm not here, if I'm not doing anything. Now, do you feel my hand on your side? Okay, so breathe normally. When I instruct you to do so, and don't do anything quite yet, I want you to just close your eyes. So go ahead and close your eyes. And when I instruct you to do so, I want you to pretend that you're breathing into my hand when you take that big deep breath in, okay? So go ahead and take a deep breath into my hand. Good. There we go. Good. Breathe into my hand. So essentially, and she's emphasizing for me, which is great, but you could potentially see the patient turn a little bit if they start really moving this rib cage a little bit more by that facilitation technique. Right? So it is a lot of this imagery, for lack of a better word, but it does really, really work, and especially for patients, if we teach them their spouses or their partners to really help them out with these techniques. They're easy, and they can just help them, quote unquote, breathe into their hand.
And now if you had a person who needed different force points of emphasis, we could say, for example, this patient might need some lateral costal expansion as well as some diaphragmatic. So Eder could move his hand and say, breathe here. Okay, now I want you to switch and try to breathe here. So I'm gonna let him talk through that with me.
So kind of same concept, and we'll start over. So I want you just to relax again. Close your eyes, literally just relax as much as you can. Perfect. And you feel my hand here on the right side of your chest by your ribs. I'm not going to apply any pressure. I'm not going to be pushing. All I want you to do is imagine with every breath you take that you're going to be breathing into my hand. So big breaths into my hand. Normal pace. Big into my hand right here. Good. Now as we switch, if you notice there's another place that's impaired, always tell your patient, especially if you have their eyes closed, what you're doing, right? I'm going to move my hand kind of right to where your belly is, and I want you to kind of sit up a little bit for me, okay? Good. And right here, now my right hand, you feel it right on your belly. I want you to just breathe into this hand now. Good. Every breath. Big. Good. So I'm going to switch the paper real quick.
And now we can stop.